Bruce, how you doing? Happy New Year.
Hey, thank you very much. Good to see you.
Good to see you. So thanks for taking the time to kind of tell us your story a little bit. I first saw you back, I think in 2014, correct?
That seems about right. It's been a while.
And just tell me kind of what you were experiencing and what happened, following treatment.
I saw your ad at the bottom of the Vail Daily, and I had just gone through MRI on my left knee where I had a lot of pain, and I had been told the meniscus was badly worn. And I still remember my surgeon telling me, hey, you're going to have to slow down, cut that basketball out, just try to ski the blue runs, etc. And I said, oh, wait a second, maybe there's another way. He was half suggesting surgery. And so anyway, I'd seen your ad and I thought I better check this out. And came in to see you, and the rest, because, the rest of that front end of the story, because my goodness, 14 days after I came in for the injection, I was skiing as you promised I could. And it took, you told me it would take a while for it to completely take hold. I couldn't believe I was free to go after 14 days. Literally, it did take 9 months. I would just guess I was 75% better in that first month. And I just kind of didn't think about it. I was so happy, but it got increasingly better for like I say, at 9 months, I felt like, wow, I've really pulled off a miracle here.
And despite my sort of encouraging you to kind of dial back the basketball, that didn't happen, correct?
If I'm feeling good, I'm going to keep going. And I played twice a week for years up to then, and I've played twice a week until this COVID thing hit as well, playing about an hour a day, and it's really been remarkable.
Well, that's great. And we treated you, that was January of 2014, and
Yeah.
then over the course of the years, you came to see me again in February of 2020, saying,
Yeah.
Things were starting to be a little sore again, correct?
Yeah, actually, my right knee this time, the first time was the left knee, the right knee started to talk to me like it needed some attention. So I came back to you, and you actually did both as long as I was in there, because the left knee was just this little pain point, but not much. And the guys at the court, they call me Bionic Man. When I first went to you, stem cell was very much a new thing, and people didn't understand it. Everybody wanted to know what I'd done, and I had similar success the second time. So, for me, Scott, you're 2 for 2.
As far as the treatment and the time spent with our office and coordinating things, what would you say about all of that?
No, nothing but the best. I mean, your initial session with me, for example, explaining it, which was all new to me, was very helpful in terms of getting confidence that I should give this a try. And then your follow-up calls to make sure I'm doing okay. And no, you've got a first-rate operation going in my book.
We appreciate you taking the time, to share your experience. Anything that you would say to other people thinking about doing this?
Yeah, I tell them to call Dr. Brandt. You know that I've done that several times and had people give you a call and come in, and I continue to feel that way. I suppose someday surgery will come my way, but it's wonderful to put it off. And like I said earlier, the quick result with it was probably the most amazing thing. So I encourage, I know a lot of people, my age, there's a lot of people with knee and hip problems, etc. And what I tell them is, here's the guy to go see. And I'll keep telling them that. You got that.
I'm glad you're continuing to do well.
You bet. I'll be skiing in a couple days again.
All right. Awesome.